Your legs are trying to warn you. Most people over 60 don't hear it. Not because the signals aren't there, but because they've been told the signals are normal. They're not. There is a 103-year-old physician in Kyoto, Japan, who has spent the last 8 decades doing something almost no cardiologist in the West does routinely. He examines the legs first, before the heart, before the blood pressure cuff, before anything else. And in those legs he reads the story of what's coming, sometimes years before a crisis ever arrives. His name is Dr. Shigeaki Hinohara. He practiced internal medicine and preventive cardiology until he was 105 years old. He saw over 150,000 patients across his career, and the single lesson he kept returning to, the one he wrote about, spoke about, and repeated in his last interviews, was this: the health of your legs after 60 is not a comfort issue. It is a survival issue. I want to tell you what he meant by that.
My name is Dr. Eleanor Marsh. I'm a vascular internist with 31 years of clinical practice, and I specialize in circulatory disorders in adults over 55. I trained partly in Japan, and Dr. Hinohara's work shaped the way I examine patients to this day. I started making these videos because of a woman named Irene. She was 67. She came into my office complaining of tired legs, said she'd mentioned it to 2 other doctors. Both told her it was age, normal, expected, nothing to worry about. 4 months after I first saw her, Irene had a deep vein thrombosis, a blood clot, in her left leg that traveled to her lung. She spent 9 days in the ICU. She survived, but Irene never forgot those 2 years she spent dismissing what her body was telling her, and neither did I. This video is for everyone who has been told to expect less from their body after 60, because you deserve better than that. Let's start with something almost nobody explains correctly. Most people think poor circulation in the legs is about blood not moving fast enough, like a lazy river. You slow down, the blood slows down. Simple. That's not what's happening. After 60, what changes is not just speed, it's the quality and flexibility of the vessel walls themselves. I always explain it to patients this way. Think of a brand new garden hose. Flexible, responsive. You squeeze it at one end, water flows freely at the other. Now think of that same hose left outside through 20 winters. It's stiff. The inside is narrowed. Even with the same water pressure, less gets through, and in some places, barely anything moves at all. Your arteries and veins are that hose, and what you do in the next few months determines whether they stay flexible or keep hardening. Here's what the data shows. According to the American Heart Association, peripheral artery disease, which is reduced blood flow to the limbs, affects over 8.5 million Americans over the age of 40. By age 70, that number climbs sharply, and the Journal of Vascular Surgery published findings showing that over 60% of patients with moderate to severe circulatory restriction in the legs had no formal diagnosis. None. They were living with it, managing around it, and calling it getting older. So let's talk about what getting older actually looks like, and what it doesn't have to. The first thing most people notice is heaviness, not pain, not cramps, just this low, dull weight in the legs by late afternoon. Like your calves have been filled with sand. You sit down and it eases slightly, so you assume it's just fatigue. You walked more than usual, you stood too long. You're not 20 anymore. But here's what's actually happening. When circulation is compromised, blood pools in the lower legs and feet because the venous return, the mechanism that pushes used blood back up toward the heart, has weakened. The calves normally act like a second pump. Every time you take a step, the calf muscle squeezes the deep veins and drives blood upward. When you're less active, or when those vein walls have lost elasticity, the pump loses efficiency. Think of it like a sump pump in a basement. It's there to push water out and keep the floor dry. The moment it loses pressure, water doesn't evacuate. It sits, and sitting water causes damage the pump alone can't fix. The heaviness you feel at 5 in the afternoon is blood sitting where it shouldn't be. Your body is telling you the pump needs help. One of the simplest things Dr. Hinohara recommended, and this is backed by a 2019 study in the European Journal of Applied Physiology, is what he called ankle cycling. 10 minutes, twice a day, even while seated. You rotate the ankles clockwise, counterclockwise, flex and point the foot in a slow, rhythmic pattern. That motion directly activates the calf pump without requiring you to walk, stand, or put pressure on joints. Do this tonight. Do it while you're watching television. 10 minutes. It costs nothing and it starts working immediately. Now, have you ever woken up in the middle of the night with a cramp in your calf so severe you had to jump out of bed? That tight, seizing, almost unbearable knot of muscle that makes you grip the edge of the mattress? Type yes in the comments if that has happened to you, because I need you to know you are not alone, and that is not just dehydration. Nocturnal leg cramps in adults over 60 are significantly associated with reduced peripheral circulation. Here's why they happen at night and not during the day. When you're active, your moving muscles generate heat and demand blood flow. The circulatory system responds. But when you lie down and stop moving, cooler blood settles. The arteries supplying the calf muscles narrow slightly in response to temperature drop. And a muscle that isn't getting enough oxygen-rich blood will eventually seize. I always explain it like this. Picture a sprinkler system in a dry field. During the heat of the day, it runs constantly and keeps everything moist. At night, when the system slows, the parts of the field with the weakest lines start to dry out first. The cramp is the field catching fire at its driest edge. The timing matters. It doesn't hit you while you're running errands. It waits until the house is quiet and the lights are out and there's nothing left between you and what your body has been trying to say all day. Research published in the Canadian Medical Association Journal found that quinine, once the standard treatment for nocturnal leg cramps, is no longer recommended due to side effects. What is supported by evidence is magnesium supplementation, calf stretching before sleep, and hydration timing. A glass of water with a small amount of magnesium glycinate an hour before bed has reduced cramp frequency in multiple clinical trials. Stretch your calves before you sleep. 10 seconds each. Hold the wall, step 1 foot back, heel flat to the floor. It takes 30 seconds and it may be the difference between sleeping through the night and gripping the mattress at 2 in the morning. But here's where I want you to pay close attention, because what comes next is something most people dismiss as nothing. Swelling in the ankles and feet. Not dramatic, fluid-filled ballooning. Just a quiet, consistent puffiness that's there at the end of the day. Your shoes feel tighter in the evening than they did in the morning. The skin around your ankles looks slightly stretched, slightly shiny. You press a finger into the top of your foot, and the indentation takes a moment to fill back in. That's called pitting edema. And it is not just a cosmetic issue. Mild, regular ankle swelling in adults over 60 is one of the earliest visible signs that venous pressure in the lower limbs is elevated. The American College of Cardiology classifies even mild bilateral lower extremity edema as a clinical indicator worth investigating, because that fluid doesn't appear out of nowhere. It leaks out of blood vessels whose walls have become more permeable, more leaky, often because the pressure inside those vessels is chronically too high. I think of it like an overloaded dam. The structure is still standing. Nothing catastrophic has happened yet, but the water is seeping through the cracks, slowly, daily. And the longer the pressure builds, the more the structure weakens. Here's what I want you to do. Elevate your legs tonight. Not a pillow propped under your feet, genuinely elevated above the level of your heart. Lie on the couch and put your legs up the back cushion, or use a wedge pillow that raises your legs to a proper angle. 20 minutes. Let gravity assist the venous return that your weakened vessel walls can no longer fully manage alone. And here's something I tell every patient who walks in with ankle swelling. Reduce your sodium intake to under 1,500 milligrams per day. Not because you have heart disease, because excess sodium tells your body to retain fluid, and retained fluid has to go somewhere. After 60, it goes to the ankles. But here's what makes this even more concerning. What I just described, the heaviness, the cramps, the swelling, those are your body operating under strain but still compensating, still managing, still working around the problem. What I'm about to describe is what happens when the compensation runs out. Skin changes in the lower leg, and not obvious ones. You might notice the skin on your shins, or the inner part of your lower leg becoming discolored. A brownish, rust-colored tint, almost like a bruise that never fully resolves. Or the skin might feel thicker, not painful, just dense, like the texture has changed. Or you might see small, dry patches that don't respond to lotion the way they used to. This is called venous stasis dermatitis, and it is a sign that chronic elevated venous pressure has been damaging the small vessels near the skin surface long enough that the skin itself has been altered. I have never seen this explained in a patient brochure, and that absence is something that genuinely troubles me, because by the time the skin changes, the circulatory problem has usually been present for years. Here's the mechanism. As blood pools chronically in the lower legs, iron-containing molecules from old red blood cells leak through weakened vessel walls and deposit in the skin tissue. That rusty discoloration, that brownish tint, is called hemosiderin staining. It is literally old blood staining the skin from the inside. Think of it like a slowly leaking ink pen left in a shirt pocket. At first, there's just a small spot, but leave it long enough, and the ink has soaked through the fabric in ways that can no longer be ignored. If you see this on your legs, please don't wait. Show your doctor. Ask specifically about venous insufficiency. Request an ankle brachial index test. That is a simple, non-invasive measurement that compares blood pressure in the ankle to blood pressure in the arm. A ratio below 0.9 suggests arterial compromise. A ratio above 1.3 suggests arterial stiffness. Both are actionable. Both are treatable. But only if you ask. Remember Irene, the woman I told you about at the very beginning? The one who spent 2 years being told her tired legs were just age? This was the sign she almost missed. Not the heaviness, not the cramps. A small, persistent patch of discolored skin on her inner left ankle. She mentioned it. Her previous doctors called it dry skin, prescribed a cream. I think about that often. What a different conversation she might have had. What might have been different in those 9 days in the ICU. And now this. The one I wish more people asked me about. Cold feet. Not uncomfortable cold, not socks help cold. Persistently, inexplicably cold feet, sometimes in summer, sometimes when the rest of your body is perfectly warm, sometimes when you're under a heavy blanket and your feet still feel like they've been outside. This is not a quirk, this is vascular. When arterial blood flow to the extremities is significantly reduced, the body prioritizes core temperature over peripheral warmth. The circulatory system pulls blood inward, toward vital organs, and the feet and lower legs receive less. The result is feet that are chronically, stubbornly cold in ways that have nothing to do with the room temperature. The best analogy I can offer, think of a building with a central heating system that's losing pressure. The rooms closest to the boiler, the central offices, stay warm. But the far ends of the building, the ones at the end of long pipe runs, those rooms get colder first. And no amount of turning up the thermostat helps, because the pressure can't carry the heat that far anymore. Your feet are the end of the pipe run. A 20-20 study in the Journal of the American Geriatric Society found that persistent cold extremities in adults over 65, particularly when combined with other circulatory signs, was strongly associated with peripheral artery disease and increased cardiovascular risk. Not just cold feet as a symptom. Cold feet as a predictor. What can you do? Walking, not aggressive walking, not cardio. 15 to 20 minutes of gentle, continuous walking daily generates enough calf pump activity to meaningfully improve distal blood flow over weeks. Dr. Hinohara walked every morning until he was past 100 years old. He called it the simplest medicine that exists. If walking is painful or not yet possible, even marching in place for 5 minutes while holding a counter produces measurable circulatory benefit. The goal is rhythmic calf activation, movement, not intensity. Here's a question I want you to sit with for a moment. How long have you been tolerating something in your legs that you've quietly accepted as just part of getting older? Drop a number in the comments. 1 year, 5 years, 10. I genuinely want to know, because that number tells me something important. Not about your age, but about how long you've been waiting for someone to take this seriously. There is one more thing I need to cover, and I want you to hear this carefully. Wounds or sores on the feet or lower legs that are slow to heal, a blister that stays open for weeks, a small cut on the toe that doesn't close the way a cut should, a raw spot on the heel that keeps reopening. You've kept it clean, you've used antiseptic, you've done everything right, and it still isn't healing. Let that land for a moment. When peripheral blood flow is severely compromised, the tissues in the lower leg and foot do not receive adequate oxygen or nutrients to support normal healing. A wound that would close in days in a healthy circulatory environment can persist for months in a leg where circulation has been chronically impaired. And open wounds, especially in diabetic patients, but not only in diabetic patients, can become entry points for infection that spreads with terrifying speed in oxygen-deprived tissue. According to the American Diabetes Association, over 100,000 lower limb amputations are performed in the United States every year. The vast majority begin with a small wound, a blister, a sore, something small that someone decided to wait on. 100,000 every year, most preventable. If you have a wound on your foot or lower leg that has not improved in 2 weeks, do not wait any longer. See a vascular specialist. Ask about wound care specifically designed for circulatory compromise. This is not alarmism. This is the reality of what delayed treatment looks like when it reaches its end point. I want to bring you back to something. Dr. Hinohara was once asked why he examined the legs before anything else, what he saw there that others missed, and he said something I have carried with me for 3 decades of practice. He said, "The legs carry us through life. When they begin to struggle, they are not failing. They are asking for attention. The tragedy is not the asking. The tragedy is when nobody listens. You have been listening. For this entire video, you have been paying attention to your body in a way that many people never do. That matters. Here is what I want you to do tonight. Just one thing. After this video ends, go lie down. Elevate your legs above your heart level for 20 minutes. Don't scroll, don't watch something else. Just let gravity help your venous system do what it's been struggling to do all day. Let the fluid move, let the pressure drop. Feel the difference. It is not a cure, but it is the beginning of listening. And if any of what I've described today sounds familiar, the heaviness, the cramps, the swelling, the cold, the skin changes, the wound that won't close, please share this video with someone who needs to hear it. Not because it's content, but because you might be giving them the thing Irene never got soon enough, someone who took their legs seriously. You deserved that all along.